So moving on to our next speaker to talk about how traumatic events shape our lives. Um, this is Dr. Saira Awan, who is the executive managing GP at Aberystwyth Medical Centre within Watford area. And Saira had studied medicine and graduated from the University of Birmingham. And she also supports a local charity called Watford Muslim Youth Centre, which organises various fundraising activities and helps to deliver community projects, but ultimately to build a new community centre within Watford. And the rest of the time she spends raising 3 beautiful children. But without further ado, let's hear her talk.
نحمده ونصلي ونسلم على رسوله الكريم أما بعد فأعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم Assalamu alaikum wa rahmatullahi wa barakatuhu. I'm Dr. Saira Awan. I'm a GP partner in Watford, and I've been asked to talk about how traumatic events can shape our lives. I'm sure that we can all recall at least one event in our lives that we would consider was traumatic for us. Over the years, my experience as a GP has really opened my eyes to the diversity of traumatic experiences that people go through and the different ways and to what extent it affects them and those around them. When I compare this to my own experiences, things I would class as traumatic for me, I actually realise that, alhamdulillah, I'm very fortunate. And for me, the realisation is that I should be more grateful and take less for granted. I started to think about this topic with a definition. So, how do we define a traumatic event? Oxford Dictionary defines it as a deeply distressing or disturbing experience. And I would say that this is certainly an accurate definition when we consider the emotions and feelings that are associated with such events. And I think it's safe to say that a traumatic event can only invoke negative emotions when it's first encountered. Feelings such as anger, sadness, despair, guilt, loneliness, and hopelessness are at the forefront. These psychological feelings can then manifest as physical symptoms such as lack of sleep, loss of appetite, or overeating even, and in turn weight loss or weight gain respectively. They can be elements of self-neglect and self-harm. These emotions and physical manifestations can continue for some people indefinitely, which means their whole lives are overshadowed by these negative feelings. Others, these feelings are temporary and can be overcome. What determines whether there is a temporary or permanent impact is a multitude of factors which all influence the direction an individual may take following a traumatic event. So, first, it's important to look at the kinds of trauma or traumatic experiences people go through in society today. The majority of patients that come to see me with mental health issues, predominantly with anxiety and depression, will almost certainly have had a traumatic life event at some point, which has been a trigger point for some of their symptoms. Many cases will have a history of family breakdown, so this could be related to divorce, alcohol or drug abuse in a family member, domestic violence, sexual abuse, or emotional abuse. These same factors, of course, can exist outside of the family structure. For some, it's related to work, such as bullying, discrimination, financial difficulty, which in turn can leave people homeless. And then, of course, all forms of terrorism, war. You know, the list could go on, but these are probably the ones most people will have been exposed to or be familiar with in the media, and sadly, for some in the communities around them, and even in people they know. So one common factor is that all of these issues are modifiable. They are created and delivered by society. And the solution ultimately is to heal society as a whole to really prevent this from happening. However, this isn't going to happen overnight or imminently, but we need to support affected individuals and promote healthy and positive inclusion in society. There are some traumas we don't have control over that are non-modifiable, such as losing a loved one, being involved in a freak accident, severe illnesses. But regardless of the type of trauma experience, the outcome is dependent on the extent of the impact on our lives. So in or out of our control, all will inevitably have an effect. The level of trauma is different for everyone and so affects individuals very differently. Some people are unfortunate to experience more than one trauma, and sometimes the cases where the subsequent traumas are a result of previous ones. The prime example of this that I've come across and has been shown in research as well is living in an abusive household as a child then can lead to people living in abusive relationships as adults. Or even worse and more upsetting is that the affected individuals can become abusers themselves. This kind of cycle is a result of not knowing any different to what they have experienced and growing up in an environment that normalizes such behavior. This again reflects flaw in society that allows a situation like this to develop in the first place. There are another multitude of confounding factors that determine the impact of trauma will have on someone. Being able to find your own coping strategies is vital to facing adversity and overcoming it. Some people establish these easily, and for others it can be a struggle, and without the right support it can be near impossible. This is why having the right support mechanisms in place makes such a difference as to how a traumatic event shapes your life. The first thing to consider is the influence of someone's character. So does someone have the strength and willpower to overcome this and see things as the cup is half full? Or are they someone who sees life as a cup half empty? I have one patient who definitely has a cup half empty attitude, and because she's given up on life, to all the bad luck she has had in her life, she lives with an abusive partner and continues to do so despite our attempts to sort of help her out of the situation. She doesn't feel she deserves any better. And so she, like I said, she's just given up on life. On the other hand, I've got a lovely colleague who took cup half full approach and removed herself from an abusive relationship 20 years ago and is now a successful healthcare professional working to be at the top of her profession. So the next thing to look at is support networks. Do they have a good network of friends and family that they can turn to or confide in? The most vulnerable individuals I've seen in my day-to-day work are those whose family support networks are weak. And in many of these families, mental health issues are established in up to 3 generations. Many young people present and start with saying that depression runs in my family. And it saddens me to hear this. It feels as though these young people have resigned themselves to the fact they, are destined to suffer with this as well. When they go on to disclose some of the significant life events, it's very easy to spot a pattern of behaviour and notice that there's a cycle of trauma. So this brings to mind a recent safeguarding case that the mum of a 15-year-old girl called me to discuss her anxiety and low mood symptoms. Mum herself has mild learning disabilities. She told me that all her anxiety and low mood had worsened recently due to her 15-year-old daughter reporting that her stepfather had raped her, and now the police were involved and the stepfather had left the home. When I looked into the records of the family, there were lots of letters from children's services. So it showed how father had physically abused the children when they were younger, and this was picked up by their school. Mum had left the home due to the abuse and left the children behind. Eventually mum reunited with them, and then the father left to be with another family. This then opened the door for stepdad to become part of the family, and of course she was exposed to another trauma again. If we imagine that this young girl had a less vulnerable upbringing and had a supportive father who looked after her and her siblings rather than abusing them, and the parents were happy together, she may not have been at such a risk later in life. What direction her life will take, she's still very young, is yet to be seen, and we can only hope that she has a positive outcome. We can't underestimate the importance of helping people through difficult times. So this includes not only family and friends, but also mental health services, support groups, schools, work environments, and faith and spiritual leaders as well. So this takes me on to faith as a factor that influences people's ability to deal with a traumatic event. People with faith will generally use their faith as their biggest support and turn to it for answers and strength and a way to achieve closure. This is even more important to those who don't have any other strong support network. Being a religious person doesn't mean that you're affected less by a traumatic event. It just provides another avenue or coping strategy for overcoming the difficult situation. However, we mustn't forget that having faith and then facing a distressing experience, may make a person question their faith or even turn away from it. So when we think about how a traumatic event shapes our lives, we can either become consumed by the events in our lives, which will inevitably bring about a negative outcome, or we can learn and change ourselves to overcome the struggles with faith, have a positive outcome, however great the adversity is. So as a GP, I have a role in trying to help people through their difficult times by addressing the psychological and physical symptoms they may present with and signposting to the correct services such as counsellors or psychologists, drug and alcohol support groups, and safeguarding teams, just to name a few. Try and get a full picture of what's gone on in a person's life and how it has affected them, and how I can help takes several consultations. But even then, I think I only reach the tip of the iceberg in most cases because some are just so complex. As a profession, we are trained to show empathy, be non-judgmental, and show compassion. And often, I find the most I can do is listen. Sometimes I don't have an answer on how to help, but I find the patients are just grateful that someone objective and non-judgmental is listening. Even though many people will seek advice from their GP as a first port of call, the reality is the medical profession is only one of the cogs in the wheel that can help in their lives following the trauma. The person themselves is the most important, and then it's their beliefs, their family members, community around them, spiritual guide, and mental health services. That directs them towards a positive or negative outcome. This multidisciplinary approach is likely to give the most beneficial outcome. As I mentioned earlier, some people don't have a family support network, some may not have a spiritual guide, so there needs to be an avenue for everyone. As a profession, we're trained to make a diagnosis. This means, we often label, in inverted commas, label a person with that diagnosis. Post-traumatic stress disorder is a common mental health diagnosis that we label people with. What some patients look for and need to help obtain a perspective on their experiences. This gives recognition to what may have happened to them, and if they are then put on medication for this diagnosis, it treats the symptoms and feelings that they have had. This is a coping mechanism for many people, and one way that people's lives are defined following a distressing event. Seen as a positive, as the patient now feels in control and can get on with their lives, but for others it's a burden and a reminder of what happened to them. I always tell my patients that having a diagnosis and medication doesn't get to the root of the issue. They really need to look and try and embark on psychological therapies and incorporate the non-medical solutions that are available as well. The difficult times in our lives, whatever the level of trauma, will no doubt impact our future decision making and the environments we expose ourselves to. We may rethink the way we treat our parents, how we look after our children and what we teach them. Our ability to trust people and form relationship with others may be influenced. There are things we may decide to completely refrain from or begin to incorporate into our lives in a bid to prevent the same trauma happening again. These are the decisions that will shape our lives. All these decisions can draw us in two directions. If we decide to take a positive stance, we will make decisions that will help us to prosper and choose environments that help us develop and thrive. We would be inclined to perhaps build bridges with family members if possible, or find that existing relationships with families and friends, family members and friends have strengthened. We are likely to become more resilient when facing hardships and recognise if we are entering a risky or vulnerable territory. This route is one where we show development and change, which is a stepping stone to improving society. This outcome requires strong beliefs, strong support networks, and strong character. A negative approach is more likely in those who are unable to let go of what may have happened and allow it to dictate their decisions and relationships. This isn't to say it is the fault of the individual. Some things are very difficult to forget and move on from. And for those who fall victim to a life of trauma, such as the example I gave above of, living with abuse from childhood to adulthood, and in some cases, even becoming the abuser, there's no alternative as they haven't been shown any other options or been able to seek the help they need. These are the cases that need early recognition and support to allow us to steer it to a desirable outcome in life. So, on a personal note, my own traumatic events have been related to losing loved ones. It's hard in any circumstances, but most recent losses have been unexpected, and I felt it was much more difficult to overcome. In some respects, I feel fortunate that this is the only kind of trauma I've had to endure, as it was something out of my control, and I haven't really had to, I've not really had to consider what could I have done differently in my life to prevent it. However, it has made me think about what I can do differently in my life going forwards, and to ensure that I can shape my life in a way that pleases Allah subhanahu wa ta'ala. So I'd like to conclude with a perfect example of positivity in the face of trauma, and that is our beloved Prophet Muhammad sallallahu alaihi wasallam. The beloved Prophet sallallahu alaihi wasallam faced many traumatic events through their life, from losing their beloved parents, beloved uncle, their beloved wife, and their beloved children. Not only these tragedies, but they faced ridicule, opposition, numerous enemies, and battles. And of course, Sallallahu Alaihi Wasallam is the best of creation, and we know that the way they were able to deal with such difficulties is beyond our capabilities or even understanding. However, they set an example for us that no matter what difficulty you face, it is possible to overcome it with faith, good character, care, and compassion for our community. If we could all follow this without wavering, we will be able to better society and overshadow the traumas people continue to face. So I'm going to finish with verse 286 from Surah Al-Baqarah, which I feel encompasses this topic. Allah does not burden a soul more than it can bear. May Allah protect us from hardships in our lives and give us the strength to overcome any difficulties we may already be facing. And may we always be grateful to Allah for whatever we face. He knows what is best for us. Ameen. Assalamu alaikum wa barakatuh.
Thank you, Dr. Saira Awan, for touching upon trauma and your experiences of that in the patients that you see and in the community relations that you have. And you touched upon how having positive and negative attitudes can make all the difference, but also about faith. And one of the strongest points I think as Muslims we are lucky to have is the connection to our Holy Prophet Muhammad sallallahu alaihi wasallam, in which when we read Durood Sharif, when we read Naat Sharif, we can really connect to the mercy of Allah subhanahu wa ta'ala and that uplifting of the soul.